Hi, my name is John Michael R. Aurelia, and for today, I'm going to do a video demonstration on the first aid and basic life support. So, watch and learn. If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911 and then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. Now we're going to discuss the things that we need to know if you find a person choking. Now we're going to do the Heimlich maneuver. The universal sign for choking is the hands crossed at the neck. If they are coughing, then they are able to breathe and you would not perform a Heimlich maneuver on them. First thing you would do is to put the pinky on the belly button, then roll it up so the knuckle on your thumb is right. There and then you thrust. You pull it in and up, but don't try it as hard. In and up until they can dislodge whatever is in there and they can breathe again. This time we're going to do the bleeding bandaging control. Let's suppose that this girl has an injury in her head, and whenever an incident has occurred and the patient has been injured, controlling bleeding is one of the rescuer's top priorities. To control bleeding with gloves on, apply pressure with a clean pad or gauze. If the patient loses too much blood, their condition can become life-threatening. Fasten the pad into the wound with a roller bandage. If the padding and the bandage becomes blood-soaked, apply another roller bandage over. This time, let's treat a person with an arm fracture. It is important that you not try to use the broken arm. Moving a broken arm would also cause more damage to blood vessels, nerves, and other tissues. To keep the broken area from moving, make a temporary splint by taping a ruler or other supportive device to the arm. Then, we should wrap it with a bandage to hold the temporary splint over. And to support the arm further, we must add a bandage or any other cloth to hold the arm over. To our next video, we are going to treat a person with a dislocated arm. We should try to keep this arm as close to the body as possible. You'll be able to feel extreme pain and lack of movement in the arm. For your first aid, we have our cravats or cloth. Go ahead and just unfold them into the triangle bandage, but try not to move the arm around too much. And we're going to put the top of the triangle at his elbow, and then this piece will go lay over the good shoulder. You don't need to cover up the whole hand because you still need to make sure and see the fingertips. After simply going around to the other side, now tie it behind her neck. Hello buddies, now we're going to treat a sprained ankle. When you come upon the ankle, try not to move it around too much. There is going to be swelling. When you're going to use a cloth bandage to wrap the foot, start above the ankle, and this is going to create your anchor. While you're going around the foot, Make sure that you're keeping control of the bandage so it doesn't become too loose. Going to go ahead and wrap all the way down to the foot from the top to the bottom. And then all your excess, you can go ahead and finish it up and go back up to the top. Afterwards, go ahead and make sure that we're checking for blood flow through the rest of the foot. And that's how we wrap a sprained ankle.